Welcome back, everyone. This is Dr. Rao from Pain and Spine Specialists. We're talking about arthritis and how it affects our back. As we know, we have several structures in the back, which include discs, nerves, bones, muscles, and joints. Arthritis is a fancy word for inflammation in joints. In these spinal joints, the facet joints, these joints on the sides of the spine, they can become inflamed, and that inflammation can cause muscle spasm in the back. That muscle spasm can give ongoing pain. It can be worse when you bend back and twist, and it can give you that ongoing lower back discomfort. If that's the case, we can treat that using medial branch nerve blocks, so diagnostic tests to inject those nerves and immediately see how much pain relief you get. If you get a significant amount of relief, that tells me that we're in the right spot. We confirm that on another day, and then we can use radiofrequency ablation energy to heat those nerves to get rid of them. That can give us 6 months to a couple years of relief. Now the nerves can regenerate, and if they do and reattach, then that pain can return and we can treat it again. But sometimes those nerves regenerate, but they do not attach. And if they don't attach to one another, then the pain doesn't come back. So this is a potentially long-term treatment for chronic arthritis pain in the lower back. Patients may see the words facet arthropathy, osteophytes, on their MRIs, and that's just other words for describing this type of arthritis. Knee arthritis. What can we do for ongoing knee pain? Well, knee pain is becoming more and more prevalent. There are good surgical treatments, but we want to try to see if we can avoid surgery unless we absolutely have to. So what are non-surgical ways to get knee treatment or knee pain relief? Well, first we can start with physical therapy. We want to try to get the muscles above and below the knee stronger. If that does not help, then we can do a steroid injection. We would get an x-ray, see what type of joint space there is, and if there's joint space narrowing or arthritis, then we can put some steroid into that knee to decrease the swelling and inflammation. And hopefully that will allow for better knee function and pain relief. Now, if that only gives temporary relief, then we can do viscosupplementation. We can put a substance into the knee that helps lubricate the knee, helps the cartilage kind of slide better so that you don't feel as much pain. That is a good way to hopefully avoid a knee replacement and get you feeling better. So for chronic knee pain, when cortisone injections and the viscosupplements don't seem to help make that knee feel better, platelet-rich plasma, or PRP, is another option. PRP is great because we draw your own blood, we spin it down, and we get the regenerative properties, and we can inject that back into the knee to hopefully get the inflammation to subside and get you feeling better. Now, if that also doesn't help, then there are exosomes which we can inject into the knee that can help regenerate and get the knee working better. If that doesn't help, then we're probably at the point where we need a knee replacement. If you have the knee replacement already done, but you still have chronic pain affecting your knee, then physical therapy would be an option. However, if the knee's been replaced, physical therapy hasn't helped, and you still have post-knee replacement pain, then we can do something called a genicular nerve block. There are nerves that go above and below the knee that we can inject with anesthetic and put a little steroid to see if we can quiet down how those nerves feel. If we can quiet down those nerves and you only get temporary relief, then we can either consider an ablation where we use radiofrequency energy to heat those nerves to get rid of them, to give you 6 months to a couple years of relief, or we can consider peripheral nerve stimulation. We can put in a little device, an electrode, that can stimulate those nerves to block the pain, and we can try it out as a trial. We put the electrode in for 3 to 5 days and we see how much pain relief you have. If you get good relief, then we can go ahead and implant this device to get you ongoing lasting relief and improve your functionality. If you're interested in learning more about any of this, please come in and give us a call.